Good afternoon, everyone, and thanks for joining us today. Again, in the Legislative Building in Regina, we have Health Minister Jim Reiter and Chief Medical Health Officer Dr. Saqib Shahab. Joining us on the line from Saskatoon is Scott Livingstone, CEO of the Saskatchewan Health Authority, and Dr. Susan Shaw, Chief Medical Officer for the Saskatchewan Health Authority. Both Minister Reiter and Dr. Shahab will have some brief opening comments, and then we'll have time for questions. Minister?
Good afternoon. Today we are reporting 19 new cases and 17 more recoveries. As has been the case for several days now, most of the new cases are related to the outbreak in and around Loche. While new cases and active cases remain low in most of the rest of Saskatchewan, there are now a lot of people working together in Loche and other northern communities to manage this outbreak. Healthcare workers, public safety officers, mayors, chiefs, other community leaders, volunteers, and so many others. They're all working together on testing, contact tracing, providing spaces for self-isolation, managing the checkpoints between communities, delivering groceries and other necessities. There's a tremendous effort underway, and I want to thank everyone involved for everything that you're doing. I also want to briefly mention a very sobering study that was just released by the National Institute on Aging. They found that of all the COVID-19 related deaths in Canada, 82% were residents of senior care homes. That's a staggering number. But it also tells us if we do everything we can to protect our long-term care homes, we will greatly reduce the number of serious outcomes, hospitalizations, and deaths. This morning, I discussed this with our health officials during our daily call. And while I think we're doing the right things at our long-term care homes, I've asked our health officials to continue to reinforce all the rules and protocols in those homes to protect our seniors who face the greatest threat from COVID-19. Once again, I want to thank all our healthcare workers and everyone in our healthcare system for everything you're doing to keep Saskatchewan safe. And I want to thank everyone in Saskatchewan for doing your part to reduce the spread of COVID-19. Now I'd like to turn it over to Dr. Shahab for a few comments.
Thank you, Minister. So I did want to take the opportunity today to just refer everyone to our website where we do update our numbers and data daily, and it's become quite a useful reference on a daily basis. So if you look at the map that's currently on the website, you can appreciate that over time our case numbers remain low in most of Saskatchewan. And especially the active cases are very low. But of course, we've seen a bit of an increase in the north, and that's primarily due to the Lloydminster hospital outbreak that is now stabilized and under control. And of course, an ongoing outbreak in the northwest of the province, where we have 152 cases, and most of them are currently active, but there have been recoveries as well, which we expect over the next few days and weeks. Most of those cases will recover while isolating at home. And then if we move further down to the table, we can appreciate again the same information in a bit more detail. So for example, in the far north, there have been 13 recoveries. In the north, out of 95 cases, there's been 58 recoveries and 3 hospitalizations. In Saskatoon, there are very few, there's been, the majority have recovered there, and there's very few active cases, and a slightly higher, because of their larger population size, slightly higher hospitalizations. But Regina, similarly, there is currently no active, there are only 3 active cases in Regina. In southern rural, there's no active case. In central part of Saskatchewan, there's no active case. So again, this just highlights that things have continued to be quiet in most of Saskatchewan, but of course in the north, around the Lloydminster area, there was some activity which is now settling down. In the far north, in the northwest primarily, there's active cases presenting, mostly in the community setting. And then finally, if you go down to another table, so as you know, we used to have a table that just showed total cases in the province, but now we've changed it to show the same thing that was also reflected in the earlier two, the map and the table. But this graph, what it shows is the solid line. That's really the number of cumulative cases, and the scale for that is on the right. So our total number of cases was kind of stabilizing for a couple of weeks. So the initial upswing was mostly due to people coming to Saskatchewan and some mass gathering events, and then it stabilized in the middle. But then it's gone up primarily due to the outbreaks in the northwest. And our curve, which we were saying is flat, we've now divided it by far north, north, central, Saskatoon, Regina, and the south. And if you look at the initial on the initial, you can see a couple of ups and downs due to exposures at mass gatherings and travel into Saskatchewan, and then it becomes very quiet and flat for 2 to 3 weeks, and then it remains quiet for the rest of Saskatchewan. In fact, it's extremely low numbers, but in the red you can see some cases primarily in the Lloydminster area that are now settling down, and of course an increase in the northwest Loche area. So that really explains why the recommendation is to proceed with reopening for the rest of Saskatchewan, and even specifically for Lloydminster, as things are pretty quiet, and they can cautiously proceed with reopening in phase 1 next week, and will continue to evaluate readiness for phase 2, while the rest of Saskatchewan will reopen. But of course, reopening plans are currently paused for the north of Saskatchewan till the situation in the northwest is stabilized. And finally, I just wanted to talk a bit about, we get a lot of questions about the advice about extended households, and different provinces have called that as your extended bubble, and so on and so forth. And so I just want to clarify that, all of us have been very good to really not meeting our friends, our family who don't live in the same household, and that's been really a very effective tool to flatten the curve. As we go out and about, we need to continue to practice physical distancing. If you're going out shopping or for other chores, we need to do all of that on an ongoing basis. But there's an opportunity now for us to choose 1 or 2 households, which may be friends or family, or 1 or 2 friends, the same households and the same friends, not 2 different households every day or 2 new friends every day, where we can interact socially in a slightly closer environment. And if all of us are healthy and don't have any underlying risk factors, we can sometimes share a meal at a table where we're not maintaining the 2-meter distance. But if they are within our 2 or 3 households, with someone is older or has underlying risk factors, we can meet maybe in our backyard, but try to maintain that that bubble around someone who's more vulnerable. Just be a bit conscious of that, and of course not meet socially. If anyone has symptoms, they should not, of course, meet within that extended bubble either. And this is really and none of those gatherings should exceed 10. So this really is up to each household and each person making a risk assessment about, obviously having a bit of an expanded social circle, the same 2 or 3 households or the same 2 or 3 people. But if anyone has some underlying risk factors, just a bit of caution around that. So I guess I'll maybe stop there. Thank you.
Thank you, Doctor. We now have about 25 minutes for questions. We'll take our first question from the phone line, operator.
We have Phil Tank with the Star Phoenix.
Yes, I have a question about the severity of the cases in the north. I mean, if we look on on one of those charts, we can see that there's 138 active cases, and I don't think I've ever seen any hospitalizations there. So does that mean that no one from the north has been hospitalized? I think we know that's not the case. And how are hospitalizations categorized here? And how are we able to gauge the severity of the cases in the north?
Yeah, so I'll talk about the far north and the north. So in the north, there have been hospitalizations, and part of them were related to actually people in hospital who were part of the outbreak in the hospital. So that's the north. In the far north, that is correct, that as far as we are aware, there have been 152 cases as on the table. 138 are active, 13 have recovered. And there we do know that most of the cases currently are in younger adults, youth and younger adults, and that has been the chain of transmission. Most households there are practicing physical distancing and and that is containing the spread. And now younger adults are being followed by public health and are being supported to self-isolate if ill or self-isolate if close contacts. And these measures should control the outbreak. We know that the rate of hospitalization and serious illness in younger adults is not zero, but much lower. Hospitalizations do occur, unfortunately, 2 to 3 weeks after exposure, initial illness. So if someone becomes symptomatic on day one, they may not need hospitalization until 7 or 8 days into the illness. So we may still see a signal for hospitalization later on, and the SHA may want to speak to some preparedness for that they have. And of course, the other reason, and this is a message really to all young people, that while we may think that, well, not me, but while young people may think that they are invincible, you have a duty to obviously prevent even your low risk of serious illness. But you can expose people within your households, people within your extended households who may be older, who may have underlying risk factors. So, that's a risk for in any situation where you can have secondary transmission to people, friends, family, close to you, elders, people with underlying risk factors. And then that second wave of exposure can result in a higher risk of hospitalization and death. And I'll just maybe ask Scott if he wants to speak to readiness if there was an increase in hospitalizations in the north.
Thanks, Shahab. So what I would follow up on there is that the entire strategy around dealing with COVID surge on the defensive side for the Saskatchewan Health Authority is contemplated where and how we will care for patients, regardless of where they come from in the province. And it's one of the advantages of having a provincial authority is as the resources in the province are under a single leadership team that has eyes on where we have availability. And we will move patients if hospitalizations are required. And to Dr. Shahab's point, following infection in that 12-day or so mark, we often see increase in hospitalizations in the sort of a typical population of COVID-19, and we will be prepared for that.
Follow-up, Phil?
Yeah. What measures are being taken to ensure that there are sufficient supplies in the Loche? I don't know what the situation is with all the stores there and everything, but is there any? I did see a post online suggesting that there might be an issue with supplies there, and I wasn't quite sure whether it was food or cleaning supplies or what. But how is the province taking care of that?
Phil, my understanding is that I think what we're checking into this, I think it might have been referring to some cleaning kits that the public safety agency is providing. So our officials are following up with the public safety agency about inventory and checking what the situation is there.
Is there a comment from the SHA on any supplies up north?
Scott, are you aware of anything further on that?
For us, with respect to supplying our facilities and staff, with respect to both PPE and swabs, etc., we don't have concerns about that. We have eyes on supply chain in the Loche just like we do everywhere else, and supplies are flowing on a regular basis when they're asked for and requested.
We'll take our next question from the room here. Karen?
The low numbers in the south, is that a result of just not testing that many people, or is there no virus around, which a lot of people are starting to think?
So there's actually, our hope is it is because of hardly any COVID-19 virus around. And we would really continue to encourage anyone with even mild symptoms to seek testing, because that will inform what they need to do for themselves and their immediate family who may be close contacts, but also will inform us in terms of ongoing activity. I would like to add, however, that while we don't want to use hospitalizations as the main indicator, because that has a 2 to 3 week lag, as we discussed for the north, the fact that we're also not seeing any increase in ICU admissions or hospitalizations in the rest of the province is also a very reliable indicator that things are quiet in the rest of the province. But we don't certainly want to use that as the indicator. We want people to actually still, even though it's spring and looking very much like summer, If you develop a dry cough, think of testing. If you have fever, think of testing. If you have a runny nose and you think it's not your seasonal allergies, think of testing. We really want to support ongoing testing, even for mild symptoms. And of course, we continue to test in settings where there's high risk, like long-term care facilities, other settings throughout the province when there's any symptoms. And that's also a good indicator if there's COVID-19 activity anywhere in the province. Thank you.
Follow-up, Karen?
How worried are you about complacency, though, given that the numbers are so low? There haven't been active cases in Central or the South for quite some time.
So I think it is very important for us not to be complacent, both in terms of not seeking testing, but not to be complacent in terms of the way we behave, because while Saskatchewan is reopening, it is not back to business as usual. It is going forward to a new normal. And I think that discipline that we have shown so diligently over the last 2 months must continue as we go about either enjoying the spring and summer weather, or if we go for some allowed services in phase one, mostly medical services. And those businesses have also set clear criteria about how you can enter. You shouldn't go if you're symptomatic, spacing in the waiting area. And as phase two starts, again, observing the same discipline when we go shopping, not going shopping if you're sick, observing that physical distancing. I think that really has to be the way we do things for the foreseeable future.
We'll take our next question from the phone line, operator.
We have David Baxter with Global.
Hey there. So with some Southern healthcare workers going up to help out in the Loche, just in the interest of trying to contain the outbreak there, what kind of precautions are in place when the Southern healthcare workers come back home when their time in the Loche is wrapped up?
So maybe I'll make an initial comment and maybe ask Scott or Susan to expand on that. So whenever people provide services close to 2 meters, either in allowed medical services in the community or as a surge response, or even in an ongoing fashion, the Saskatchewan Health Authority, as long as appropriate PPE is being used, you are not considered exposed. And while all healthcare workers are now under ongoing self-monitoring, so twice a day, symptom review, temperature check, you can continue to work in whatever setting you are required to work in. The only cautions we have, of course, is that we want to minimize healthcare workers working in more than one setting if they work in a long-term care facility. But beyond that, as long as appropriate PPE is used, the risk should be minimal if you work in one setting versus another. But in case there are any specific provisions for staff going north, I'll maybe defer to Scott and Susan.
Yeah, Susan Shaw here, and I agree with what Dr. Shahab said. It's about the appropriate use of PPE for the situation within which you're working. And all healthcare workers are asked to self-monitor. And of course, if we have any symptoms, we are not to report to work. It's one of the reasons why we have the masking policy for all staff and why our temperatures are checked when we enter the buildings. So as long as the PPE is in use and the status of the patient is known, then there's no need for restrictions when a staff member who has traveled to support another area of the province returns to their usual home and location.
Follow up, David?
Yeah, this is for Dr. Shahab. With Michael Bodo writing to the province requesting a bit of a committee to look at what could the options be should the election go forward in the fall, he was requesting that you take part in this committee as well. Do you think we could safely hold an election this fall given the ongoing pandemic?
So I'll make some general comments, and then so first of all, we have demonstrated that through essential work that happened over the last 2 months, that you can go out and shop or go to an essential workplace in a way that, as long as you maintain physical distancing, you can minimize or eliminate the risk of transmission to a large extent. So I think we have learned a lot from those practices over the last 8 weeks that have allowed us to now plan for reopening in phase 2 other sectors of the economy that in some cases are workplaces where people have to maintain physical distancing, or in other cases are non-essential retail environments where people can go and purchase other non-essential items in a way that maintains physical distancing. So for other activities, like for example voting, specific provisions can apply, which can minimize the risk. Now, of course, if there was a significant increase in COVID activity, those provisions would have to be looked at again, and it is impossible to predict if we will see a surge or a spike in the future, and when that will be. And certainly till such time that there's an effective therapeutics or a vaccine, which may be many months into the future, that risk will always remain. So I will maybe leave my comments to this, that it is possible, especially in a situation where most of Saskatchewan is at present, if that maintains, to safely engage in activities that can include participating in an election. But of course, whenever elections are called, other provisions may apply based on the situation, either provincially or in specific parts of the province.
We'll take our next question from the phone line.
We have Mark Smith with CTV.
Hi, what is the province doing to ensure that an outbreak doesn't occur at a meat processing plant in Saskatchewan, similar to what happened in Alberta?
So workplaces are a very important place where we want to minimize the risk of transmission. And so we have already said that people who can work from home should continue to work from home. But of course, there are many essential workplaces, and food production is an essential activity that needs to be supported. So from that perspective, health in partnership with agriculture is inspecting meat processing plants. There's cooperation between those plants and health and agriculture to develop protocols that will minimize any risk of transmission among workers. Many processing plants are already well aware of the events that have happened in other parts of North America. But I just want to just finish by saying that health has been in partnership with agriculture, actively inspecting these plants and verifying that the highest level of precautions and protocols are in place to minimize the introduction of COVID into the workflow. So that means the same things that apply to hospitals and other settings, daily screen before you go to work and when you show up to work, and then within the workplace, minimizing opportunities of transmission, which are not just at the work floor. It's also when people are changing in or changing out. It's also when people are having meals where you can stagger the breaks and have that separation during breaks and meal times as well. All those aspects are really important to minimize transmission in those settings as well. Thank you.
Follow up, Mark?
Yes. Are we going to be ramping up inspections of these places to make sure that they are following these guidelines and that there isn't an outbreak?
So initial inspections have occurred, and they will continue to occur, but that relationship is always there between health, agriculture, and those work sites to continue to get clarity on what further can be done to minimize risk of transmission.
We'll take our next question from the phone line.
We have Alicia Bridges with CBC.
Hi, thank you. We've heard this week how the Gen Expert machines are being used to increase testing in the Loche, and that anyone who wants to be tested can be tested, but a community notice issued by the health authority locally in the north 3 days ago said that testing capacity is limited, that there's a backlog in contacting people with their results, and that a government aircraft is being used to ship results faster. So are you able to explain it in more detail how accessible testing is really for anyone who may want it, but is not experiencing symptoms yet?
I'll start, Alicia, and then I'll ask Scott to add to it. I've had a number of discussions on this with officials. The plan there, and I believe it's in place now, is anyone who wishes to be tested in the Loche area can be tested. As far as the capability of testing. The new Gen Expert machine is up there, and we do have a limited amount province-wide of cartridges for it. So the standard testing isn't done by that machine, but the conventional way. But essentially, anybody that needs or wishes to be tested in that area can be. Scott, can I just get you to add to that?
Sure, I'll just follow up. So just again about the Gen Expert machines and the distribution of those machines throughout the province, is those machines have been put in place to provide fast access, as you know already, that the turnaround time is much faster and can be done on an individual basis. With respect to the minister's comments about the availability of testing, that is what's going on up in Loche, and we have been busy, not just focusing on contacts, but also focusing on expanding testing throughout the community for anybody who wants it. I believe we've tested now over 800 people in the Loche and surrounding areas. Now, specifically to the question around air transport, because of the size and scope of what's going on in the Northwest, we made a decision not to use traditional mechanisms to take swabs out of the north for testing. So what we do is we use airplane daily to take whatever swab that day that's not urgent to our major facility in Regina, so that the testing can be done as batch testing overnight with our reference lab. And we've done that to expedite the testing so that there's no ground transport delays associated with getting results back in the community.
Follow up, Alicia?
Yes, thank you. The FSAN, the opposition, and health experts have now, along with the Saskatchewan Information and Privacy Commissioner, all say that you should immediately release statistics on coronavirus and people with other medical conditions. I'm wondering, will you do that, and why or why not?
So on that one, obviously as a government, we want to be as transparent as we can, as transparent as possible. There's certainly sometimes there's privacy concerns around it, and we're also in a situation where we need to respect the advice of our officials. So I'm not sure if one of the others, Dr. Shahab or Scott, if they want to add to it, or Dr. Shahab.
I can speak to some preliminary data that we have that I can share, but again, I will just pull that information up. So I just want to start off by saying that when our case numbers for hospitalization were low, it was very challenging for us to release any information that would compromise confidentiality, but we were very clear to say that we don't expect COVID-19 to behave differently in Saskatchewan as it has behaved in the rest of the world, especially Europe and North America, where hospitalization and deaths are higher risk in persons who are older and have underlying comorbidities. We are now getting some information that is more granular, and once we can aggregate that, we can share that in more detail, but we continue to see that our inpatient hospitalizations are more likely in individuals who are older. They are more likely in males, so that is very consistent with what has been seen in the rest of the world. And all the risk factors that have been described in countries who have had thousands of cases are similar to the risk factors in Saskatchewan. And again, we have had fairly low number of hospitalizations, thankfully, but even in those low numbers, the risk factors are similar to what has been described in other parts of the world, including hypertension, other heart disease, diabetes, lung disease, immunosuppression due to malignancy or underlying disease. So again, there are no surprises here. But what it means for us as citizens is what we talked about earlier, that if you are otherwise young and healthy, maybe under 40, your illness can be milder, and we're seeing that in the outbreak in the Loche. But you can still have a low but real risk of serious illness and death. It's much lower, but it can happen. And if you're older than 40, with each progressive 10-year increase in age, your risk of hospitalizing serious illness goes higher. It also goes higher if you have underlying risk factors that can include all the things I mentioned: heart disease, diabetes, lung disease, being a male, being a smoker. And those are all the reasons why when we choose to expand our virtual household, if you are older or if I have underlying risk factors, you may still want to take additional precautions when you engage in those activities or when you choose to go out for non-essential shopping or other services. You may wish to choose a high level of precautions for yourself, and for others who may be around you also need to take that, have that thoughtfulness of protecting you from unnecessary exposure as well.
We'll take our next question from the room here. Karen?
Just given that we know many of the individual communities where there are cases, has any thought been given to naming the 11 central and 15 southern communities where the positive cases were found?
So I just want to say that when we talk about individual cases, let's say there's a small community of 500 people, and there's one case who may have been exposed while working in an essential work site or other setting and healthcare, and they are safely isolating. There's little value, and we absolutely do want to continue to observe that confidentiality. But when we have an outbreak situation where the public needs to know, because it may impact how they may choose to access a service, or it may restrict some services in an institutional setting, or it may entail some additional capacity that is being deployed, then that information is made public. Whenever there's an outbreak, that information is shared, whether it's a community outbreak, whether it's an institutional outbreak, like in a long-term care facility or a health facility, that is shared. And there's two reasons for that. One is that it does impact people who may not be able to access some services, and in a community outbreak, it just promotes a higher level of vigilance for everyone. But now, with reopening Saskatchewan, whenever there's a community outbreak, it may also require for some of those phases to either be delayed or to be some of the restrictions to be put back in place. So I think while we were in lockdown, there was little value. There was obviously no need to inform if there was an individual safely self-isolating in the home. But when there was a mass gathering event, and there's a need to inform the public because everyone couldn't be contacted, otherwise a public service announcement was given. And going forward, as we reopen, obviously when you can't contact everyone who's been exposed, a public service announcement will be given. But otherwise, if there's an outbreak that has an impact on how people can otherwise access other services going forward, like through reopening, and if they have to be restricted, then of course that information will be made available, not just as part of an outbreak notification, but other measures that may have to be put in place again for a limited period of time in a limited geographical area because of an outbreak. Now, but having said that, we really don't want to see that happening multiple times. And the key to that is with all of us, that if we continue to practice physical distancing, we can proceed with the reopening and minimize the risk of those clusters or outbreaks in the community setting. But if they do happen, then that communication will happen in a way to inform the public and also those businesses who may have to just either apply additional precautions or may have to temporarily suspend their operations while that is brought under control.
Follow up, Karen?
No, that's fine.
We'll take our next question from the phone line, operator.
We have Dan Jones with Mississippi.
Yeah, good afternoon, Minister Reiter. I just want to go back to the Loche cleaning kits and supplies. It appears that after today's deliveries, the community will be out for the next few days. Can you just go through the procurement and how your ministry will ensure that there will be sufficient supplies to that community?
Dan, it's not, as far as the type of supplies you're talking about, like the cleaning supplies, it's not health that's dealing with that. It's a public safety agency. So as I mentioned in the earlier one, I'm going to have to follow up with them. I'd be happy to have one of the staff in my office get back to you on that today yet, though.
Follow up, Dan?
Yes, I do. This is either to Scott or Dr. Shahab. I understand that the Air Range co-op is closed due to some precautionary testing for COVID-19. At least possibly 4 people are being tested. Is there an outbreak there? And B, are you guys doing testing in that facility?
So I'm not aware of the details, and we can get back to you unless, Scott, you are aware of the details.
I'm not.
We will follow up.
Okay, thank you.
We'll have follow-ups for both of those items for you, Dan. And we have one last question on the phone line, operator.
We have Lisa Schick with CJME.
Lisa, do we have you on the line?
Sorry about that. In the numbers today, community contacts have gone up quite a bit and unknown transmission cases have gone up by more than a few. So what exactly is happening for us to see these numbers? Are there large gatherings that have happened that have kind of caused those specific numbers to go up? And are you concerned with us seeing unknown transmissions going up like this?
So that is one of the key indicators that we watch, and I will be able to provide some of that in a more granular detail at a future media briefing. But certainly, even in a setting where there's a community outbreak, like in the Loche area, on the one hand, we expect most of the secondary transmission to happen within the household setting. And so when the SHA teams go house to house and investigate, whenever there's a case, especially if there's crowding in the household setting, we do expect to see, unfortunately, secondary cases in the household setting. And the vast majority of cases are, secondary cases are in those household settings, and that's how the outbreak continues for a while till it stabilizes. But of course, we continue to see exposures where an individual can't name a case, and that is critical. That is critical to understand, how the outbreak is transmitting, and that is exactly why all the measures that have been in place for the last 2 months need to continue to be in place in the Loche, which include no mixing within households. So the virtual bubble that I talked about, or 2 or 3 households getting together, that cannot apply right now to a setting where there's an outbreak like in the Loche area. And we also know that 10% of cases can be transmitting when you're asymptomatic. So that's why we say you have to maintain physical distancing at all times, even if you have no symptoms. If you have any symptoms, you shouldn't go out to shop in any case. So those principles are critical to controlling the outbreak. It's testing, it's case content investigation, but the first pillar, physical distancing at all times, is critical. And the fact that there are a significant minority of cases being discovered through the case content investigation who cannot name an exposure is a critical piece of information to inform the community, and that's what local public health staff and medical health also are doing with leadership in the community, that it's not just good enough if 3/4 or 80% of the community is self-isolating and 20% isn't. All of us have to practice physical distancing at all times, otherwise we will continue to see community outbreaks.
Follow-up, Lisa?
Yes, we've been hearing the last couple of days that there's more resources being sent up to the far north to kind of deal with this problem. We've heard before that things like this, we may not see their effect on the numbers for a week or two. So are we going to be seeing this get worse before it gets better?
Yeah, so again, the positive tests today were people who were exposed 1 or 2 weeks ago. So the testing results, so the testing numbers that we watch for every day show what is happening 1 or 2 weeks ago. So any interventions you put in today, we hope will show an impact in reduced testing numbers 1 to 2 weeks into the future. So you are absolutely correct from that perspective. So you have to look at what can be done today and how will that have an impact into the future. And a 2-week period is a good yardstick of measuring the impact of any interventions.
And that concludes our time for today. Thank you very much for joining us today.